Well, welcome, and thank you to our Centenary community and our listeners who are connecting with us as we enter into today's session spotlighting Christian discernment, the COVID vaccine, and our health and wellness. My name is Rhonda Strouse, and I'm serving as the session's host today, and I just give a big welcome to all who are joining us. While we're currently seeing a slowdown of the pandemic, we're still learning, obviously, about the COVID vaccine itself. We know it's had a significant impact in countering COVID's effects broadly, and it's considered a primary response. We also know that it's a personal decision to pursue and can be one of discernment, and particularly given its newness and that we didn't have a lot of time to really respond and think through and had to react perhaps through a barrage of information that may or may not be true. So the Centenary Reentry Team has been following the pandemic closely since its beginning, and we've been evaluating protocols and information which best serves the Centenary faith community, especially through a lens of spiritual, emotional, and physical care response. And this now includes the vaccine, which that effort is now occurring. So the Reentry Team's goal was to provide an opportunity through this interview to provide access to information and based upon trusted experience and insights. And to give us that experience and insight, we look at our two Centenary members, two of our own, Dr. Donald Douglas and Dr. Kevin Schuer, who've both been actively engaged with many in the medical profession these days, and especially patients who are seeking advice regarding the vaccine. Let me introduce them. Dr. Donald Douglas is an anesthesiologist who's been involved in healthcare for more than 40 years and has served on numerous national, state, and local medical committees while keeping up with medical trends and treatment advances. He's currently practicing regenerative medicine in Lexington and enjoys participating in our community and educational outreach options. Dr. Kevin Schuer is with the University of Kentucky College of Health Sciences as an associate professor, serving on the faculty in the UK Physician Assistant Studies Department. He has patient care responsibilities in the UK Outpatient General Internal Medicine Group and has his doctoral degree in public health. Gentlemen, welcome this morning as we begin our conversation. Thank you for being here. Appreciate you.
It's nice to be here.
Good morning.
Yeah. So as we join together and in creating kind of this conversation of what we can trust and what we can know as we discern the vaccine, we know that many people have already made up their mind, right, about whether or not they're going to take the vaccine, but there's still also folks who are still uncertain, who still have questions and have not decided. There are adults, especially, who've been kind of in this first round, but now we're entering into the youth and then anticipation of younger children. And so I guess our primary question here is, how do we know what's best for us as we consider especially our faith and science in this time that we are experiencing? So what should an individual consider in discerning whether or not the vaccine is right for them? How do we know what's safe for us to do? And I open that up to either of you who would like to begin.
Well, I'm happy to start. Thank you, Rhonda and Dr. Douglas for participating, Rhonda for setting this up. I think this is great. The first couple things that come to mind as far as discernment, I have a lot of these discussions in clinic with people who are trying to make the best decision. The first thing that comes to mind is not necessarily a faith thing, but it's just this reminder of having a primary care clinician in your life that you trust, that helps you make decisions on all things, including the vaccination. I think that's the most important piece to that. That's the first thing that comes to mind is, having that trusted individual in your life to help you discern.
Absolutely. Absolutely. That trust is essential. Yeah.
Again, thank you, Donna. I mean, Rhonda, and certainly Dr. Schuler, I agree. I think that over the more recent years, we've lost some contact with one of the central figures in our life, which should be our primary care provider. So there are a lot of things, a lot of media outlets that you'll hear who will try to make individual decisions for you. We need to be able to make individual decisions for ourselves. And I think our primary care our healthcare providers are the first places to start. Some of the things they will discuss with you include age.
Mm-hmm.
I think depending upon our age, there certainly are different decisions that we're going to make, or that our healthcare provider is going to give us regarding whether or not we should highly consider the vaccine. Certainly the amount of socialization and the amount of contacts that we have is an influence. And one of the more important influences that our primary care people will talk to us about are some of the what we call comorbidities. That is, those things that seem to add up to put us in a higher risk group.
Yes.
But again, as Dr. Schuer has already mentioned, primary care providers really can give us a great deal of very, very good information.
Mm-hmm. Absolutely. And I think that's why we wanted to include the two of you. You know, the idea of having someone that you can trust and someone that you can share your real concerns or fears or just seek good understanding, that's really key. And so I appreciate that folks can hear that message directly from the two of you who serve in those roles, that you want people to come to you. You want people to seek out their physician so that they can really know what works and what's best for them. So I think that's a really important message for folks to hear. And if you don't have a primary physician, that there are still many options and resources. Would you talk a little bit about, if I don't have a primary physician or someone I feel like I can go to, what would you suggest for me? Because in this world of community medicine and urgent treatment centers and lots of different places, what advice would you give me?
Yeah, that's a great question. I mean, so it's a challenging answer. I don't know if Dr. Douglas feels the same way. It's probably because of our bias in medicine, and we feel like medicine answers would need to come from medical professionals, you know. And so, but I understand, and I have friends who struggle with just that, which is, you know, I don't have anybody. What might be the next step for me? And so my gut response would be, I think I do want to sort of underscore, as we've been talking about, you know, primary care clinicians helping you make decisions about your health and wellness. In the absence of that, it gets a little tricky because, as Dr. Douglas just mentioned, the world is throwing information at us constantly. And I also see that. I know Dr. Douglas sees it, which is confusion and misinformation. Right. And it's dangerous. And so I guess in summary, for me, first understanding where people are and how they're making decisions, what resources do they have available to them, and then really promoting this idea of getting with again, a primary care clinician who can help you navigate decision making.
Absolutely. Absolutely. Well, I appreciate that we acknowledge that piece, because I think that's such a critical element. Again, amidst the barrage of information, who do I go to? Who can I trust? And so I appreciate your candid response there, that's a critical element in the process as you're discerning what's best for you.
And for those who don't have access to primary care providers, one of the things I often suggest to my patients is that they speak with their friends, speak with family members who are in the healthcare system, or who do have primary care providers. Those are wonderful ways of getting references regarding which physician you may want to see, which nurse practitioner you may want to see. It at least gives you a foot into the door. I have found that often those who don't go see their healthcare providers are often afraid because of some of the stories that they hear. Find someone that you trust, see who it is that they are seeing, set up an appointment to go see someone and see if you like that provider. And in fact, it's really interesting because you may find one provider in the group that, you all just don't get along, but there may be another provider in that group who works very, very well for you. So the big thing is, you have to make the first step of contacting someone to find a provider.
Absolutely.
Mhm.
That's excellent advice. Excellent advice. Thank you for that. Well, let's look a little bit, as a church family and church body, and looking at this through a faith-based lens as Christians. How does our faith play into our discernment for our decisions for health and wellness? As we're looking at the science, but also marrying that with our faith, for where we may be undecided or uncertain. How does our faith play into this role of discernment?
Yeah, that's a great question. And reflecting on that a little bit, I think our faith has the answers for all of life's challenges, really. Jesus lays it out very explicitly. The Bible lays it all out for us to lean in and to not be anxious, and to use your community circle to make decisions. You're thinking of Christ and his disciples. But for me, and it's something that I promote as a clinician, obviously within the walls of the church and then even outside of the walls of the church, that and it reminds me, actually, Rhonda, that that's a big sort of component of the work that I do as a primary care provider, which is trying to understand where people are in their decision making, and if they rely heavily on faith, trying to figure out again, if it's faith that rely centrally on, having that discussion with them, and encouraging them to lean in on their faith and their beliefs in making difficult decisions. And so, your question is complicated in that I think that all answers really do come from the Holy Spirit if we're listening and obedient. But in terms of the work that maybe Dr. Douglas and I do, I think it's really important to first understand where people are, and that they may not have a faith. So you may have to figure out how to help them with their decision making in an absence of really a faith belief. But if they, a lot of the patients that we see do have a faith, and how can we sort of leverage that to help them make the best decisions for their health?
I appreciate too that we recognize that faith element is a critical piece of our own journey and our wellness and in our decision making. Dr. Douglas, do you have any thoughts as well on that?
I do, and I certainly agree with Dr. Schuer. Our faith is paramount in not just the decisions that we make about healthcare, but the decisions that we make in our lives. But sometimes we get to healthcare and we want to make different decisions based on what we feel is best. I think God is guiding us, and I think God guides us as individuals. I think we need to be very careful separating some of what the secular world wants us to do and what God wants us to do. I still believe that God guides us as individuals, and that means that we have to depend on him, and we actually have to ask some of those hard questions. My friends are telling me to do this.
Yes.
Should I do this? It doesn't make sense for me to do this. God, I don't feel that you're leading me this way. So what I do in my office, and God is in my office, I often talk to my patients about my faith. And it's surprising the number of people who say, well, gosh, I didn't know you could be a physician and be a Christian.
Right.
So I think God asks us to bring that to put that on our backs and carry it wherever we go, check in with him. I think God also asks us to be the disciples and share our faith with others, which is what I still do at the office. So I'm very, very happy to find a number of people who will say, thank you for your information. I'm really glad it sounds like you're a Christian. I feel better about the information that you're giving me. So again, what I would emphasize is, let's look at this from an individual standpoint instead of wanting to be like the person next door or like Susie across the street we're on the other side of town.
Mhm.
We need to discern, what is God asking me to do? And I think if we sit down, I think that'll come.
Mhm. Yeah, and I think that's important to make that point, that each person has to discern for themselves. That we can receive a lot of information and have trusted resources, but ultimately, the Spirit leads us and informs us through that wisdom that we gain through those trusted sources, such as what we're doing this morning. What about?
Rhonda, I would like to add one other thing.
Sure.
Understand that healthcare is a very, very objective area.
Mhm.
Sometimes it's emotional, often it isn't. We
Mhm.
are taught to be very objective. If
Yes.
we make emotional decisions, sometimes things don't turn out as well as they would if we make simply objective decisions. So sometimes when you're talking to your healthcare provider, he or she may say something that may not sound just right to you, but understand the position from which they are coming. They're
Mhm.
looking at what is best for you, not necessarily what makes you the happiest. And often we want to do what
Mhm.
makes us feel good or what makes us the happiest. And that may
Yes.
be what is best for us from a healthcare perspective. I just want to say that.
Oh, no, I think that's an essential distinction to make. And again, I think that's why, amidst all of this information that we're receiving, it's a very emotional topic, and it can also instill fear, right? Or uncertainty or a lack of confidence. And so we need someone who can be honest and truthful with us
Mhm.
in an objective way, which I think is, again, why this conversation is occurring, so that we can kind of walk through knowing that we have confidence in the decisions that we're making based upon trusted information, even if it scares us a bit, right? Or we're just not sure about what's best and right at this time.
Well, not understanding the information or being unsure of the information is very, very scary. It
Yeah.
is very
Absolutely.
scary.
Yeah.
This whole situation, Rhonda, you mentioned one of the words. One of the words I often use is terrified.
Hmm.
My patients come in, and again, I'm an anesthesiologist, but I still get these types of questions, and they are very terrified. When people get to an area of being terrified, often they look at simply survival.
Mhm.
Just want to survive. And
Yes.
they also go into this mode of, I want information that's going to help me feel better.
Hmm.
Simply ask them to stop back, to sit back and take a deep breath, look at their lives, look at the people around them. Do certain things make sense?
Mhm.
Absolutely.
Yeah, that's good. Yeah,
Yeah.
just in response to that.
Thank you for that.
Yeah, that's really good. It just reminds me when as we're talking about the vaccination and we're talking about information and we're also talking about faith. One of the things that I've tried to do that I've learned from great Christian mentors and clinicians is to really invite the Holy Spirit in. Even before I start clinic, invite the Holy Spirit in um, to help guide and frame and shape all the conversations that I'm going to have. The second thing that I've seen, I know Dr. Douglas has seen this as well, is yes, we are consumers. People in our culture, we consume information, and it's challenging when folks come in and have already made 1 + 1 = 4
Hmm.
about scientific concepts. So I actually encourage patients to listen and to read and to consume all the information, if they're okay with coming in and helping me, and I'm helping them put it into its rightful context. I think that's what, as clinicians, that's what we're trained to do. I mean, any of the information about a vaccination or vaccine science, you can look back for decades and read about it and come in and make your own conclusions about it. But Dr. Douglas and I are trained in helping people understand the context of the larger health system, the body, how all of this manifests. And so if patients are willing to allow us to help them with their nugget of information, help them understand that in the larger context of the health and the body and all the physiologic processes that go on, then I think I've had a lot more luck with people who are willing to say, okay, I really don't understand the context, but I've heard about vaccination from this person and this news source, and so help me understand that. I think that's when I've seen the greatest fruit from the conversations.
Mm-hmm. Yeah. Absolutely. Yeah, I think we want people to be informed. We want people to engage, right? Yeah. I think the other, sometimes what can happen is the relationship between the physician or wherever we're gathering our information is, we just tell me what I need to do, or, versus I think it's a healthy thing to be engaged in your health and your wellness and asking questions, because you want to be confident. And I know as physicians, you want your patients to be confident also in the decisions that they're making. Yeah, very, very important. We've talked a bit about the focus on the individual discernment, this idea of the community at large, right? And our decisions affect the community at large. Do you have any comments relative to that connection? So as I make a decision that may be different than another individual, how do we balance that in the community that we share together? What would you say to folks who are saying, but what if Dr. Douglas decides to do this and Dr. Schuer decides to do this, and they're different? Who's right? Who's wrong? Neither.
Could you ask easier questions, Rhonda, this morning? I take a shot at this, Don. I think it's situational. First of all, I think meaning what are we really disagreeing about? And I see this a lot with our students. Is they will pick up on, and this may not answer the question directly, so you need to help bring us back. But I see this happen in our patients, and they pick up on how guidelines change, even national guidelines about a variety of blood pressure, cholesterol, whatever, disagree on the numbers where we need to treat, for instance. They pick up on these numbers, and clinically, honestly, the numbers actually don't make a whole lot of difference. I'm just talking about blood sugar. Is it without going into the medicine, is blood sugar a problem if it's greater than 180 or greater than 200? Well, it really doesn't clinically matter. So they may be making a little bit of a mountain out of a molehill, and they're trying to understand what is the difference? Why is there a difference? And so, working them through that, and our patients have the same questions. But if we're really talking about, let's say, to vaccinate or not to vaccinate, and there's a discrepancy between providers, I've seen this, and I think it's a big problem, because it's, yet again, if we're asking patients to come to the medical community to seek answers, and they see division, their options alternatively outside of medicine now, since medicine can't, in this example, can't get their act together, the consequences of them getting information from who, name the source, is potentially life-threatening. I mean, literally. So I'm not sure how we do it. I think we first need to discern the situation, and if there can be a little wiggle room between the discrepancy. But yes, unfortunately, there has been situations where I've been aware that clinicians have disagreed on really whether to vaccinate or not, and it's unfortunate. That was my timer, I think.
Yeah, and
Thank you.
And if I may, Rhonda, I agree with those things. I think that we sometimes want to look at absolute numbers. In medicine, we actually treat individuals. Right. We don't treat absolute number.
Mhm. Right.
As an anesthesiologist, I may see a particular number in you and be concerned about it, and see a number in someone else and totally be unconcerned. Now,
Right.
my perspective, what I do is I explain to my patients why I'm not concerned about this particular number in them, but I
Mhm.
be concerned about this particular number in you. And
Right.
we get into what's called variable expression.
Mhm.
It occurs
Yes.
all the time. There may be a bacteria. There, in this case, we're talking about a virus. The virus affects people differentially. And even when we talk about this particular virus, we have to discern between colonization and infection. Just because you have the virus doesn't mean you're infected.
Mhm.
Right.
Even when we get to
Yeah.
the infected category, we have to look at just because you're infected doesn't mean you're symptomatic.
Right.
And if you're symptomatic, it doesn't mean that you're going to have to go to the hospital. If you go to the hospital, it doesn't mean you're going to be put on a ventilator.
Right.
So
Right.
one of the problems that we have is that we're putting all of these things in one category and saying,
Mhm.
you need to worry if something turns up positive,
Mhm.
which is why when we look at the different populations, everyone gets concerned. I have numbers. I don't want to throw out numbers because that can be just as confusing to people.
Right. Right.
But some of the differences that you see in healthcare providers saying, yes, I think you should get the vaccine. Maybe you need to wait on the vaccine. No, I don't think you need to worry about the vaccine right now because of some of the other things going on, some of the other issues that you have for which the vaccine might not be appropriate.
Mhm. Right.
In looking at those things, that's why I emphasize go to your primary care provider.
Mhm.
Find out what's best for you as the individual. If you want to listen to all the social media and all the other things, sometimes I even say look at those things almost like they're a comedy show and laugh at some things.
Mhm.
May or may not have any
Right.
effect on you. So
Right.
I would ask folks, don't be upset if you hear one doctor say this and another doctor say this, because sometimes they don't tell you whether it is a clinically practicing physician, whether it's
Mhm.
an administrative physician, whether it is a research physician, whether it is a PhD who is giving you this information. We all get different feedbacks from our patients. So I would ask just a little bit of grace be given to the healthcare providers who are trying to give you the best information that they have based on the population that they see and based on the research that they read.
Absolutely. I think I appreciate the layout, and I appreciate the two of you letting me kind of put you on the spot a little bit, but it's kind of the reality of the world that we're living in right now. But I think in a world where we hear 1 minute snippets about what's happening or the latest research without the context, that's where it gets dangerous. And I think that's where, to this point of giving grace and recognizing that each of us come with unique needs and unique interests and responses to those needs, that we can't cast this large judgment, if you will, for the decisions that individuals have made. We trust that they have gathered the right information, the best information for what their need is, and that we respect that.
Mm-hmm.
Yeah.
If we hear something from our primary care physician, my suggestion is that we don't go then talk to our neighbor or the guy down the street and give them the same weight. And Rhonda, what you're saying about how our society has changed is just that. I often tell my patients, if I'm worried about a bridge, I'm not going to go to my elementary school teacher to see how stable it is. I'm probably going to believe the bridge builder who's been building for 40 years.
Yeah, absolutely.
It's interesting.
Absolutely.
It just reminded me, Dr. Douglas just reminded me of I read this. I'm sorry, I can't figure it. I'm not remembering where I read this. It may have. I'm not sure who it was from, but I think in terms of what we were just talking about if I feel like a bridge is unstable, I need to find the engineers and not necessarily. I think we have seen a lack of trust in expertise, and
Mhm.
that may have been self-inflicted. I'm not sure. It may have been social media's fault. It may have been the medical community's fault. Not sure. Medicine in this country historically, there is distrust out there, which we won't get into, but there has always been distrust. There were people very distrustful of polio vaccination when it came out.
Mhm.
And so again, I think it's vital. I think what you're hearing is we tell our patients to consume information, but allow us, people who have spent a career or developed professionally a deep understanding of medicine and how the body is put together up until this point, allow us to be able to help you put that nugget of information that you're
Mhm.
absolute about, which, by the way, there's not a whole lot of things that are absolute in medicine,
Mhm.
but allow us to put that into its rightful context.
Yeah. Yeah, absolutely. Absolutely. I just so appreciate that we're having this conversation and that we can hear from two trusted voices, again, who understand the role and relationship that's so essential to an individual's health and wellness. And it is that relationship and that connectivity with a core provider that they can come to and ask. I would ask for a couple of last minute responses here relative to, we've talked about consuming information. Do we, from each of you, are there particular resources that you might suggest folks explore or go to? We'll also have some posted with this particular conversation on the website, but anything in particular that you would recommend or suggest as people are studying and reading or listening?
Yeah, I'll take a shot. I think the list I think I sent to you, Rhonda, I can't dial up all of them off the top of my head,
Mhm.
but for me, as a clinician and as a teacher, CDC has always been, in terms of infectious disease, it's always been the gold standard. I understand the political context around CDC and governmental agencies, but we have a lot of very smart people who have been for decades contributing to that operation. So CDC is always a great resource. I do think, just to plug in for local and state public health or health departments, I think those have been very good in terms of understanding the pandemic and COVID as it relates to our local community. I think those are trusted and really good resources. And then I have other for just general medicine consumption that I think are important, but those two come to mind in terms of the pandemic and vaccination for sure.
Okay, great. Thank you. Dr. Douglas,
For
suggestions?
informational purposes, if someone wants to come to understand how viruses work and they're worried about the vaccine and how the vaccines were developed, which also is a big deal. There's a gentleman,
Yes, it is.
a Dr. Shane Crotty, his first name Shane, last name Crotty, Crotty. He's a PhD at La Jolla. Let me see here, La Jolla Institute of Immunology. He's an immunologist, virologist. And he has some excellent things on YouTube. Two of the really good ones is how safe are RNA vaccines, because this is an RNA vaccine and not a DNA vaccine for COVID-19. So how safe is the RNA vaccine for COVID-19? Another one is COVID-19 immunity. And it says immunity versus the variants. And we didn't get into talking about any of the variants.
No.
Wearing masks and distancing, which is what a lot of people will hear about. Do I have to wear the mask? Do I have to stay away? So those are the things that seem to be coming up in a lot of the patients who ask me questions. So if someone were to go to his site, those are two very good videos to watch and get a
Excellent.
deal of information. As Dr. Schuer has mentioned, the COVID data numbers, the COVID data number site that Kentucky has is very, very good in giving you a line of how the virus has affected people over time, the climb in cases versus deaths, which is what I would encourage everyone to pay attention to. Hearing the number of cases is totally different than the number of deaths, and also discerning between the number of COVID deaths versus COVID-related deaths. Words, especially in healthcare, words mean a great deal. And in knowing and in educating yourself about some of these things, that also will help a lot with the terror that some people are feeling.
No, I think, again, both of you have given, I think, some nuanced distinctions this morning in terms of how we're listening and what we're hearing, and being able to discern even through those subtle but important differences in how information is being presented. So I thank you both for being willing to kind of fine tune, if you will, how we listen and how we take that information in. From our last moments here, I just give an opportunity to each of you for any closing comments. I've really enjoyed this conversation this morning, gained a lot from it, and I'm hoping our listeners as well have gained a bit more confidence and trust and direction in how to move forward if they're still uncertain, whether it's about the vaccine or any other important decision that you're making for your health and wellness. But closing thoughts.
The thing that comes to mind for me and Dr. Douglas, it reminded me of this as he was speaking, is that I think I can speak for him in terms of, we have a heart for people and being relational with people. And our faith calls us to be relational, whether we're a physician, teacher, whatever. And that is the most important aspect, I feel, to the work that Dr. Douglas and I do. Is sure, it took a lot of time to study and to read and it's medicine is challenging, but at the end of the day, it's can you relate to people? And if you can relate to people and they can trust you, and then these sort of conversations are much, much richer, as Dr. Douglas mentioned earlier about his discussions with patients in terms of his faith and sharing his faith. I think that is the most meaningful part of what we do. And if that is there, if the trust is there, if we understand people and how they make decisions, we can help them with these decisions. And I'm happy to speak to anybody about this, just to help them understand and to make them feel more confident, comfortable in a world that's changes every second.
Absolutely. I appreciate that. That key is relationship, as we know, both in our faith and in our science. And Dr. Douglas, closing comments?
Yeah, what I'd like to do is I'd like to thank you, Dr. Schuer, for the information that you provided and the relief that you provided, I'm sure, to many, many people who are listening today. And Rhonda, I want to thank you for the opportunity to participate in this. My approach to medicine doesn't differ and doesn't change my faith in God. I think that God teaches us as individuals to follow him and follow what he wishes us to do. I do the same thing here at the office every day. I believe that God is watching out for us. I believe that God has provided us as healthcare providers information and opportunity to help everyone. And that's what we want to do. We want to communicate these are the things that we can do. These are the limitations of what we know. And I also often talked about with kids, these are the limitations of what we know in medicine, and this is what I can do.
Right.
And there has to be a level of acceptance. There is a level of acceptance. So I just want to thank you both for the participation and the opportunity. I too am happy to share, but But I always warn folks, understand that I often ask the question, would you like me to tell you the truth? Or do you hear something that helps you feel better?
Mm-hmm.
My perspective is, let me give you the truth about what I know and let you ruminate on that.
Mm-hmm. That's good.
Absolutely. Well, I think that's what we're looking for. We're looking for the truth, we're looking for trust, and we're looking for relationship as we make our way and discern, particularly through our faith. And so I appreciate the time and commitment that each of you have brought to this conversation, and also in just to your daily work that you give so freely of yourselves. If anyone would like more information on, as you've listened to this conversation, we do have resources that we're posting onto the Centenary website. So feel free to research and look at those links that have been provided through both Dr. Schuer and Dr. Douglas, as well as some other at-large resources available to you. We thank you for your time, to everyone involved, and we especially thank you to our listeners and those who are interested in connecting with Centenary. We're always welcoming you and want to be in relationship with you. Thank you all.